Prenatal care for twin pregnancies is different than for singleton pregnancies. But does it mean that you'll be treated with kid gloves? What kind of testing and procedures can you expect? Do you have to see a specialist? I'm Joanna Adamczak, a perinatologist at the San Diego Perinatal Center, here to talk about prenatal care with twins. This is Twin Talks, episode number 9.
The ultrasound shows your babies to be healthy.
What? Did you say babies? You're huge. Are you having twins?
Are they natural?
Which one do you like better?
Twins, huh? My neighbor's cousin's brother's uncle's a twin.
So can they read each other's minds?
How do you tell them apart?
Twins? You got a 2 for 1.
Do twins run in your family?
Double trouble.
You're not having any more, are you?
At least you're not Octomom.
If you're pregnant with twins, or you're an experienced twin parent, odds are you've heard it all before. Now it's time to hear from the experts. This is Twin Talks, Parenting Times 2. Welcome to Twin Talks, broadcasting from the Birth Education Center of San Diego. Twin Talks is your weekly online, on-the-go support group for expecting and new parents of twins. I'm your host, Christine Stewart Fitzgerald. Have you heard about the Twin Talks Club? Our members get bonus content after each new show, plus special giveaways and discounts. Subscribe to our monthly Twin Talks newsletter and learn about the latest episodes available. And another way you can stay connected is by downloading our free Twin Talks app available on the Android and iTunes marketplace. And I want to turn this over to Shelly, our producer, to talk about our virtual panelist program.
If you're interested in staying connected from home, you can follow us on Facebook or on Twitter. We also have a new virtual panelist program. You can use the hashtag TwinTalksVP to join in the conversation.
Thank you. And so before we get started, I'd like to go around. We've got a full room. We've got panelists here. And let's do a little quick introduction. Just tell us about your family and ages of your kids.
Hi, I'm Brandy Wallace. I'm a mother of 2 spontaneous sets of twins.
Woohoo!
I have identical boys that will be 4 very shortly, and I have fraternal boy-girl twins that recently turned 1.
Awesome. That's my hats are off to you.
I know, right? Seriously.
It's all I know, people. It's all I know.
And over here we have Shelly, our producer.
Hi, Shelly Steely. I have 2 boys, identical. Their names are Grayson and Sawyer, and they're 15 months old.
All right, and Sunny.
All right, so I am a mom already of 2 little boys, not twins, although they are fairly close in age. One is 3. His name's Sayer, which is close to Sawyer, but not quite. Everyone tries to say Sawyer, Shelley, so I kind of feel you on that. But Sayer is almost, actually, he's over 3 years old, and Urban is my youngest right now. He is 18 months old, and I'm pregnant with identical twin girls who are due in about a month, so...
Woohoo!
Everyone thinks
down.
I'm full term now, because they don't know, that it's twins most of the time. And so they're like, wow, you're ready to pop. And I'm like, no, I got another month.
Some of us got those comments at 6 months.
Yeah, right. I know. I feel fortunate, though. I do.
And I'm your host, Christine Stewart Fitzgerald. And I can say Brandy and I were pregnant at the same time. So both times. So I know, which is funny. So my girls just turned 4, and then I have a singleton, thankfully, who just turned 1. So we were just within months of each other. So I can say I'm thankful I have 3, and I've got all girls. Before we start today's show, let's look at some of the headlines in the news. There was an article that mentioned how in Pennsylvania there are some rumors that it will become illegal for people to touch pregnant women's bellies without consent, and this would fall under the harassment laws. So basically, if someone came up to you and touched you and you didn't give them prior permission, they could be charged with harassment. So I don't know. What do you guys think? I mean, is this something that's smart? It's a form of protection, or do you think this is just like way over the top and crazy?
Shelly.
I think it's a great idea. I'm not sure I would actually go as far as to call the police to, have somebody, but I'm not somebody who really likes to be touched to begin with. Like, I'm not a hugger. I really have to know you before I'm comfortable coming up and getting in your space. And so it was really disconcerting for me to have people just coming up and, luckily it didn't happen too often with strangers. I mentioned earlier, I'm a teacher, so I have a good glare. So if they got too close, I could just kind of give them the eye, and that would back them off. But friends and family, that's fine. But I don't know. I mean, maybe a little over the top, but I think there needs to be more awareness that just because I am pregnant doesn't mean you get to touch my body at all.
It almost seems like with when you're pregnant, I mean, there's this open invitation to touch and give advice, and there's this sort of warm fuzzy feeling. It's like, well, and who gave you permission to do
exactly.
that?
I'm on the other end of the spectrum from Shelley. I actually didn't mind it. I welcomed it. I wasn't walking around sticking my belly out and saying, touch this. But but at some point I did feel like a Buddha a little, like everyone trying to rub. But I just felt like they were such miracles and such blessings that I just wanted to share it with anybody. And if they felt like they, could bond with me somehow, a perfect stranger in the grocery store, and it made their day, I was fine with it.
Oh, that's awesome. You're sharing your experience with everyone.
That's it.
Yeah, it didn't really bother me too much either. But I have to say that most people I feel, and maybe it's just, the circles that I run in, are pretty respectful of it. I feel like the message has kind of gotten out there a little bit, like back off, So I don't know. At least the people that I come in contact with, the only people that are touching me are the people that I wouldn't mind touching me. So, I don't know. That's been a really big issue for me.
It might be a bigger deal if you're somewhere more crowded, I mean, here, like somewhere like on the East Coast where people are like commuting by foot a lot, public transportation in close spaces, there's a lot more opportunity. I mean, Southern California, we love our cars, right? When are you ever with 50 people surrounding
pretty insulated.
you? Yeah.
I think the bigger problem for me is me touching people with my belly unintentionally. They're going to start to claim abuse from me.
That's a good point.
Didn't see you there.
Excuse me. Make way. Yeah.
I will say though, even though I think the law would be a little silly, especially how would they enforce it? And like Shelley said, would you have to stop what you're doing and call the local police?
Right.
I actually ask all of my friends, my very dear friends, is it okay if I touch, or I even just announce I'm coming in, just to let them, because I do feel there is a respect thing there. Although with my belly, it was just out there, and I didn't care.
So today's topic is prenatal care with twins, and we're talking with Dr. Joanna Adamczak, perinatologist at the San Diego Perinatal Center, and she's helped many twin mamas over the years. And so let's see here. So, looking at the prenatal care, and I mean, you're a specialist, so when the twin moms get referred to you, they already know, okay, this is going to be different than a singleton pregnancy. So, so generally, I mean, when does that usually happen? I mean, so when do most of the expectant moms even find out that they're having twins?
Usually by about 10 or 11 weeks of pregnancy, they'll find out there's twins.
So 10 or 11 weeks. So that's pretty, early on. That's
pretty early on.
Even before we start showing, before we even make that official announcement.
Sure. From a perinatology standpoint, we really prefer to see twins as soon as possible in the pregnancy because it really depends. It's really important how to care for a twin pregnancy when you know what type of twins you are, meaning are they identical or are they fraternal twins? The care is very different for those types of twin pregnancies. So the earlier you see a twin pregnancy, the earlier you could do an ultrasound and kind of diagnose what type of twin pregnancy it is.
Mm-hmm. So now out of all of the twin pregnancies, I mean, is pretty much everyone referred to a specialist or do some moms, you just get their care through their regular OB?
Yeah. I think their care can always be through a regular OB. I don't think a perinatologist needs to necessarily care for the pregnancy. I think we prefer to at least see a twin pregnancy once or twice, at least for an ultrasound. Mm-hmm. A big thing that a perinatologist does is ultrasound. So while we may not always necessarily do the full prenatal care, seeing a perinatologist again for an ultrasound is important, but I may be a little biased.
So Randy and I saw the same OB, and he is a perinatologist, and he actually specializes just in multiple pregnancies. So when I went in for my 8-week appointment to hopefully see a heartbeat, and we saw 2. The whole conversation changed. It went from what kind of doctor would you like to this is the doctor you will be seeing. Give him a call. And so it was nice just to know that my regular doctor could answer all of the questions, and he was up on all of the most detailed literature. And because he saw so many special cases, he could reassure me that mine wasn't that special.
Yes, it's nice not to be special in a twin pregnancy, to be honest.
I thought it was great to be able to see somebody who dealt with that on a regular basis. I probably wouldn't have been as comfortable with just a regular OB with how many questions I had. But I think it's personal.
So, I mean, some people, I guess they might have a relationship with a healthcare provider and just want to have that continuity of care through that healthcare provider. But then it sounds like they might be referred to you just for those specialty kind of tests. And can you, tell us a little bit more about what's the type of care? I mean, you mentioned ultrasounds. What other kind of testing do you do?
So with ultrasound, really it's not just ultrasound to take a look at the baby. So there's different types of ultrasounds that we do throughout a twin pregnancy. We'll do what's called a nuchal translucency ultrasound in the very beginning of the pregnancy, again around 11 to 13 weeks of the pregnancy. And that ultrasound is specifically to look at the back of the baby's neck, which kind of gives us a predictive factor whether there's any chromosomal abnormalities. So unfortunately twins, because there's 2 of them, are at higher risk for having genetic or chromosomal abnormalities. So the earlier you could do that ultrasound, the better. And then after that pregnancy, we like to do what's called a detailed anatomy ultrasound, which is usually at about 20 weeks of pregnancy. And that's to look at the anatomy, because twins have higher risk of congenital anomalies, either heart problems or spinal problems. And that's, again, not to say that all twins will, but again, these are things that you want to be screened for.
And also, I think in your office, I understand as well, there are, besides the perinatologists themselves, there's also genetic counselors as well.
Yeah, so we have genetic counselors on staff, which definitely helps us out because, and I'm not sure if this is common, but in general, advanced maternal age is considered 35 years, but in twins, it actually is decreased. So
we're all feeling pretty old there.
Yes, me too. So genetic counselors really help us to kind of sit down with expecting parents and to let them know what types of genetic tests are available. Medicine and science is changing so quickly. Now we used to only have what's called invasive testing for chromosomal abnormalities. So CVS, chorionic villus sample, or an amniocentesis, which are invasive. There are risks with those tests. There's risks of miscarriage. Fortunately, now we have much better tests that are either really screening tests, but with twin pregnancies from a genetic standpoint can tell us with about 99% accuracy the chromosomes of the babies, which is huge.
Wow, that is amazing. Because I think prior to this, the really only way would be to take samples from the amniotic fluid.
Correct. Yeah, the amniocentesis or a CVS, which is done early in the pregnancy at about 11 to 13 weeks again, and where we take basically a little placental biopsy and test the genetics that way.
Wow. Now, did anyone here on our panelists have any of these type of tests done, or just?
So I just had the nuchal translucency screening combined with the blood work, and then I think they call it the quad screen.
Correct.
So all the standard blood work, and I thought it was great. It was really reassuring because we just kind of wanted to know what would be happening with the pregnancy and if there was anything that we needed to know about how it will be managed throughout. So that was really helpful for us. And you can actually, like you said, getting the paperwork back that said there's a 1 in a million chance that your babies have any kind of chromosomal abnormalities was good to know, so that we could have that kind of sense of, just that we knew what was going on. Especially a twin pregnancy is scary to begin with. So I think that if there was anything else going on, we really would have wanted to know early so we could get the best possible care.
Oh, definitely. Now, throughout the care, I know there's a lot of different types of tests at different stages in the pregnancy. So maybe you can tell, when do these tests take place in different trimesters? And then also in ultrasounds, does the frequency change?
With twins, yeah.
Yes.
So the frequency changes a lot with twins. In general, twins, we like to do ultrasounds every month. So if they're fraternal twins, so di twins, brother and sister, or sister and sister, essentially just sharing a home, the uterus, we like to see those twins every 4 weeks, and that's just to do the growth ultrasounds and make sure there's not what we call a discordance in the growth of the two babies. We want to make sure that they're within kind of 20% of each other as far as their growth profiles are concerned. If you have mono-di twins, which are the identical twins, then those twins really increase in their frequency of ultrasounds. Those now we like to scan every 2 weeks.
Wow.
And they're not long, scans. They're just a quick little scan to take a look at a few kind of important parameters to make sure there isn't a development of what's called twin-to-twin transfusion syndrome. So with identical twins, they share a placenta, and with that, they share the blood vessels, and sometimes these blood vessels don't distribute blood flow equally to both babies. So one kind of takes a lot and one gives a lot, and so there's a discordance in their growth, and that can be problematic.
And when you recommend having it every 2 weeks, that's in the second trimester?
Yes, that's starting at 16 weeks gestation. So at 16 weeks with identical twins, we'll see you every 2 weeks up until about 34 or so weeks.
Wow.
Yeah.
And that's identical twins that share a placenta? Because not all identicals do. I know it's rare, I think, for some identicals to each have their own.
Yeah, my identical twins had their own placenta.
Mm-hmm.
Yes.
Yep.
Well, yeah, they didn't
Yeah.
even know. They didn't even know with both of you.
Yeah,
with
so
Christine
we both
and
had
Shelley.
they had their own placentas, and so I thought they told me that they were most likely fraternal, but there was a small chance they could be identical twins, and we had to do a DNA test to actually figure out that they were identical, but the egg just split early enough that they implanted separately.
Yeah, very rarely can you have identicals not.
I've seen it a lot
Sharing.
more than I thought, though. It happened with, yours,
Yeah.
and then a couple girls in my twin group also.
What?
Yeah.
Yeah. Well, and it is. And
What's in the water in
I
San Diego?
know. It is. But it's interesting that you're talking about this sort of like, I guess, unusual, bit here about the identicals. Because, in my case, I had we now know they're identicals, but during the pregnancy, they were treated as fraternal twins. They weren't, so they're the separate sacs. And from what I guess we were told is that the separate placentas had fused together. So that was the view. So I actually don't know if they shared a placenta or if they were two placentas.
So
fused.
And mine were totally separate.
So
they
to go
were not
into
even close.
into your story and the
Yeah.
splitting of the egg, the important part is that the egg split so early on that the placenta split as well.
Yeah.
So if they're identical twins with two separate placentas, then yes, even though they're quote unquote identical, you can manage them as
So
fraternal because the crux of the story or the important part is that placenta.
Right. And I had the DIMO that split so late that all we saw was a membrane that was, I called it my spider web. It was so thin that it actually wasn't discovered in the early part of the pregnancy.
Wow.
Despite high-level perinatology care and ultrasound videos and everything else. But so I had what you're discussing every 2 week monitoring with my DIMO identicals, and then the second pregnancy with the fraternals. We got to space them out a lot more.
We did have a little bit more. Sawyer, my baby B, he had velamentous cord insertion, which means the cord inserts on the side of the placenta, like into the. So they were more closely monitored for growth because it can cause concerns. But miraculously, he turned out the exact same size as his brother,
which just again goes to the importance of early ultrasound.
Yeah.
I just, as a perinatologist, I can't stress that enough for twin pregnancies, because it just makes everything so much easier down the road instead of seeing, a twin mom for the first time exactly at 24 weeks, and you're sitting there hemming and hawing trying to figure out, are they identical? Are they not? What do you do?
I know. I have a friend right now who's seeing midwives, and she won't have her first ultrasound until 20 weeks. And I'm like, are you sure you don't want to just check to make sure there's not two? Are you sure? It could be two.
Well, and I actually have a
You're
question.
giving me palpitations.
And actually, I have a question for the doctor about that. If someone is desiring midwifery care, is that the correct way to say it? And they find out they're having twins, is it sort of a standard of practice that the midwives will not treat them, or is it a patient preference, or does it go back to the almighty depends on how the pregnancy is going?
Right.
Yeah.
Who does the delivery? Yeah.
Well, you're speaking to a very biased person here now. From a, not only an OB, but a perinatologist, where unfortunately I see the worst of the worst.
Yeah.
And so hence kind of my bias towards hospital deliveries, at least. I think if you're having a midwife, I think that's absolutely perfect. But my preference with twins is a hospital setting rather
I
than.
suppose some hospitals have their own rules about that.
I mean, some hospitals will have midwives. I mean, where I trained, we had a huge midwifery practice that delivered tons of babies, and there's nothing wrong with that. It's wonderful.
It's hard to find midwives that will take patients who are pregnant with twins because there's it's a higher risk, and so it becomes a liability for the practice. Because I had
good to hear.
Well, I mean, you have to manage your risks and benefits, and so I had looked into wanting midwife care, and the midwives at my hospital don't take twin patients, and they don't do twin deliveries in the birth center there, and that's pretty common. Just good. Because you really want to have that monitoring and just be somewhere in case the worst. Just like for me, example, I had a completely normal boring twin pregnancy, and it could have been a really boring delivery, except for the babies got stuck, and it was good that I was in the best place for that to happen, that you have that hospital right there. And especially with how early twins are born sometimes.
Well, and I have to say, I thoroughly enjoyed all of the ultrasound pictures I got to take home.
Too.
I would highly recommend a perinatologist.
That's right.
I have a stack. It's like,
I know.
what do you do?
We do love to scan.
But now, I mean, in terms of delivery, though, I mean, now I know, like in my case, so I was seeing my OB, and I was getting those. Well, in my case, it was just every month going to the perinatal center, and because I guess that's because everyone thought they were fraternal, but so I said, well, does that mean that the perinatologist is going to make the delivery? And they said, no, it's your OB, everything's normal. So I said, okay, that's cool. I mean, and for me, that felt good because I was trying to create my birth plan, and and I felt like I had a little bit more time to sort of chat and that sort of thing with her. So I don't know. I mean, now Dr. Adamczak, I mean, like, out of all your patients, I mean, how many do you do deliveries? I mean,
so our practice in general, perinatologist as a specialty in and of itself is really ultrasound and consultative. So we don't do too many deliveries. We will take on kind of total care private patients. When either a general OB says, hey, listen, this is just too complicated, the twins have a growth discordance or something is going on. So we'll take on those types of twins, or we will take on pregnancies. If, let's say, God forbid, in your first pregnancy you had some complication, and then you were a perinatal patient, and then you got pregnant again, and you do have that continuity of care, and we as docs, we like that too. So we'll take on pregnancies from that perspective, but in general, you don't need a perinatologist to deliver you.
Okay. Well, that's good to know. So if we have a relationship with a midwife or an OB, then it really sounds like we just have to talk to them and see if they're comfortable doing that and find out about the hospital policy.
I was going to say, I will say that the hospital where Shelley and I delivered, they have hospital lists. So your OB doesn't even deliver you unless they happen to be on staff at the hospital that particular day. So you go in.
So they're on call, right?
No.
No?
No. A hospitalist is like basically somebody who is in the hospital from 7 a.m. to 7 p.m. and it's and then
that's their
PM.
shift.
It's
that's
all
their
they
shift.
do
Yes.
every day.
There are
day
perinatologists on call. For example, my perinatologist delivered my sister-in-law's baby, not mine, because he was on call and she was there.
They do rotations.
Yeah, they do rotations through. But yeah, it's all. It's it's a big teaching hospital, so
It was a different concept from what I had ever heard of before, which is the only reason I wanted to mention it here, because I know other women listening may have a different situation. I was shocked that my own OB and then perinatologist, neither of them would likely be the one delivering my children.
That is one of the nice things about having a cesarean. I'm just saying, because I started out with having an OB that delivered my last son, and I just loved her, and I was heartbroken. She told me I had to go see a perinatologist, but she's like, with any luck, you'll be back to see me, and I can just treat you. So I didn't think it was a big deal. I thought this was just one appointment to see the perinatologist, and then I go in to see her, and luckily, I just loved her. I loved her just as much as my OB, and we get along really great. But she's like, oh yeah, you're not going back to your OB.
Oh my gosh.
Oh yeah, she's like, no, no, you're just with me, and then every 2-week appointments and stuff. And she is doing the C-section. But again, it's a scheduled thing.
Even a scheduled C-sections at our particular hospital is not likely with your doctor.
And you never know. I mean, so I had an emergency C-section, so I had a doctor in there with me who was taking me into the operating room, and then a more emergent situation came up. And my doctor left. The doctor who did my C-section, I couldn't even pick her out of a lineup. I honestly don't know. But for me, it was I had the same nurses there. The nurse that was there before the C-section was there after. I saw the same staff. I had the same. So for me, and when you go to a big hospital, you kind of get.
I actually enjoyed it.
Yeah,
I found a lot of benefits to it. That
you get comfortable
this
with
is
a lot
what
of
they
people.
do all day in, day out.
Yeah.
They didn't just come from a consult or an office visit with someone who was 13 weeks pregnant.
Yeah.
They're delivering babies every single day, all day, and I found great comfort, and I love the level of care I got. So it's
really,
not wah, wah, wah kind of situation.
So that sounds like something. Then looking at birth plans is like, okay, do I want to have the delivery with my OB, and if it's at some crazy time in the morning, how's that going to factor in? Or maybe I can just plan, and it's almost more predictable if you're okay having somebody else that you don't know, but then they're available. You're not waiting. So that's
Always ask questions.
Yeah, know what the situation is, for sure.
Know how that particular office does things.
excellent. Welcome back. Today we're with Dr. Joanna Adam-Dack talking about what we can expect in prenatal care with twin pregnancies and how they're different from singleton pregnancies. I know one of the things we tend to look at is diet. A lot of people sometimes assume that, if I have 2, then okay, should be eating for 3, but maybe that's not the case. What are some of the recommended dietary changes, and do pregnant twin mamas get referred to dietitians, or how does that work?
Well, pregnant twin moms have a higher rate of gestational diabetes. Surprising, Sunny, that you didn't get it this time. So congratulations to you. And when there is a diagnosis of gestational diabetes, we absolutely always refer to a nutritionist to kind of go over glycemic index, how many sugars a pregnant mom can have, and basically what are good sugars versus bad sugars. So sugars that are broken down very quickly, just the kind of the bad sugars, white breads, and so on and so forth, versus things that stay in your body longer. So we will refer to nutritionists in that perspective. But in general, twin moms should increase their diet a little bit. They should eat more kind of balanced diets with more fruits and leafy greens. A lot of times your iron levels decrease, so eating more spinach type of vegetables is important because it will increase your iron counts, and you don't want to be taking iron pills if you don't have to
and get constipated.
Yes.
I am taking 2 iron pills a day.
Yes.
But I haven't had the constipation issue.
You are so not fair. Everything about her pregnancy is just making me jealous.
I took the pills and I didn't have that issue.
It was awful. It was probably my worst pregnancy symptom.
Yeah.
So in other words, your choice is take pills, maybe constipated, or eat spinach.
Or eat spinach.
Hey.
Right.
We like that.
I go for the spinach.
Seriously.
Some of the differences too, comparing twin pregnancies to singletons. I know we were talking about just all the ultrasounds. And I think you'd mentioned that the if we're going to a perinatologist center, there's usually much more detailed equipment that's available, and you're doing a much more detailed form of ultrasound. What's the purpose of those detailed ultrasounds, and what are you actually looking at?
Oh, great question. So in the beginning, the first part of the ultrasound, we really look to see what kind of a twin pregnancy it is. Then when we do the actual detailed anatomy ultrasound, we look at pretty much anything that you can think of. The baby's brain, the baby's heart, kidneys, stomach, bones, pretty much every part of the anatomy, and that gives us clues as to the well-being of the baby, and also whether there are any chromosomal abnormalities, which unfortunately with twin pregnancies are a little bit increased. So that initial anatomy ultrasound looks at that, and then as the gestation progresses, we do ultrasounds to look at the growth of the babies. So twin pregnancies are at a higher risk for what's called IUGR, so intrauterine growth restriction, because the placenta sometimes can outgrow its blood supply and the baby doesn't get enough nutrients. So we'll do these ultrasounds to measure the growth of the kiddos and make sure that everybody is growing proportionally to each other and proportionally to how far along in the pregnancy you are, 30 weeks, 32 weeks, whatever it happens to be.
And I think you mentioned, so it's all a different approach too if it's the mono or mono di or fraternal. I mean, so you're definitely looking for different things. So.
Yeah, you're looking for different things. You're in each type of twin pregnancy, you're always looking at the growth, but you're also looking, as Brandy had mentioned earlier, twin-to-twin transfusion with the mono dyes.
Right, and fluid.
Right.
we look for lots of fluid pockets around the babies. What does that mean for a mom with DIMAs?
So fluid is kind of one of our best predictors if there is a development of kind of unequal sharing of blood supply of the babies. Fluid in general, whether it's a twin pregnancy or a singleton pregnancy, is a good kind of surrogate marker for placental well-being. So if your placenta is healthy, it's supplying enough blood to the baby is then supplying enough blood to the kidneys, and with kidneys then you pee, and amniotic fluid is essentially baby pee. And so
my babies are peeing a lot.
There you go. Good babies. The kiddos are smart inside, so just like all of us, when we're sick, our bodies preferentially shunt blood to the most important parts of our bodies, your heart and your head. Your kidneys, unfortunately, are not very important. And so when there's low fluid, that can be a sign or a clue that, something is going on with the pregnancy, with the placenta. And so looking at fluid volumes, as Brandy had said, is very, very important in both types of twins, but especially in mono di.
Mm-hmm, mm-hmm. And I guess, I don't know, you guys have had a lot of different tests as well. I'm looking over here at Sunny, and you're getting these every couple weeks as well?
Every 2 weeks, looking for the fluid, also measuring the babies to make sure one isn't much bigger than the other, and both are within normal ranges, And then the other thing that's different with this is after my perinatologist does all of that, then there's also the vaginal exam, with the wand. I don't know what it's called. It's
transvaginal probe.
There you go. Just to check out the cervix and
Correct.
make sure that,
it's nice and long.
That's nice and long.
Yes.
She says I have a beautiful cervix.
Oh, I say that to my patients too. I'm like, I bet you've never heard that before. Your cervix is beautiful.
So with a singleton pregnancy, they only do cervix checks maybe towards the end to see if there's any chance that they're dilating at all. And so it was kind of funny for me talking to people who were pregnant with singletons, because I had cervix checks up until 34 weeks, and then I didn't get them anymore because they could already see what they needed to see and schedule that. And then my friends had the other, they got the cervix checks at the end. But yeah, you're looking for a nice long closed cervix.
Yeah, so with singletons, we'll check a cervix once at about the 20-week scan. I mean, we'll check everybody's cervix at 20 weeks.
IUGR, intrauterine growth restriction. What would it tell you if you saw that on an ultrasound? What would it?
So IUGR, again, is really, it tells us that the placenta is not working well, that something is going on, whether it's the placenta that just sometimes didn't implant correctly, as the pregnancy was developing early on, or, it could be a marker that a mom has high blood pressure, has something called preeclampsia, or gestational hypertension, which can affect the blood vessels in the placenta and then in turn affect the amount of blood going to the kiddo. And babies are small and they're growth restricted, and so that becomes problematic.
And how would you treat?
So it's really dependent on the gestational age. So the treatment really changes if a pregnancy is greater than 34 weeks or less than 34 weeks. After 34 weeks, whether it doesn't matter what type of twin pregnancy you are, if there is evidence of growth restriction, we may talk about delivery options, or we may talk about more intensive surveillance, meaning in hospital admissions, where we do, instead of, twice a week testing. We do daily testing to kind of show us if a baby is in any type of distress and that needs a delivery. But less than 34 weeks, we try to do everything possible to keep a mom pregnant as long as possible.
So long is good.
Long is good.
Well, hey, thanks so much, Joanna, for joining us today. And for more information about prenatal care with twins, or for more information about any of our experts or panelists, visit our episode page on our website. And this conversation continues for members of our Twin Talks Club. And after the show, Dr. Adamczak will talk about when twin moms should start discussing birth plans with their provider. For more information about the Twin Talks Club, visit our website, twintalks.com. So we have a question from one of our listeners, came in on our Facebook page. This is Shelly from Arizona. She says, my twins share the same placenta, and I was told that there is risk of twin-to-twin transfusion. What exactly is that?
Hi, Shelly. I'm Sean Donishman. I'm a perinatologist at the San Diego Perinatal Center. Excellent question. So when your babies share one placenta, and about 10 to 15% of the time, they are at an increased risk of developing twin-twin transfusion syndrome. And that's when these pumpkins when they're sharing the same placenta, they share blood vessels as well. And if one baby gives more blood to the other that's receiving back, that can cause twin-twin transfusion syndrome. The management of this depends on the timing of diagnosis. So if twin-twin transfusion is suspected, for example, at 16 weeks, then this requires usually surgery. So you will be referred by your obstetrician to a perinatologist, and the perinatologist will refer you to fetal surgery centers, for example, in Los Angeles or San Francisco or in Florida. And what they do, the best treatment for this is laser treatment. So there are different stages of twin-twin transfusion syndrome depending on what they see. Remember, again, if one baby is giving more blood to the other, that baby gets smaller, that baby stops peeing, the bladder gets much smaller or non-existent, you can't see it. Everything on ultrasound that's fluid-filled or blood-filled is dark. So if you don't see a dark spot where we want to see the bladder and not much fluid, and we see this baby much smaller than the other, or at least starting to show that, we suspect twin-twin transfusion. So depending on, for example, the bladder, the fluid, what the blood flow looks like within the umbilical cord as it's going from baby to placenta, these pumpkins may need surgery to cauterize the communicating vessels, so it allows for both babies to be growing well. If the diagnosis is made, for example, at 32 weeks, so much later, the treatment is much easier. You get delivered, you get prepped, you get betamethasone to perk up our baby's lungs, and you get delivered earlier. Your doctor is right, and this is something that they look for. That's why you're going to have very frequent ultrasounds every 2 weeks looking for this and looking for just signs of potential growth restriction in one of your angels.
So that wraps up our show for today. We appreciate you listening to Twin Talks, and join in on the discussion by posting your comments on the Twin Talks Facebook page or calling our voicemail at 619-866-4775. And don't forget to check out our sister shows, Preggie Pals for expecting parents, and the Boob group for moms who breastfeed their babies, and Parent Savers, an online support group for new parents. And next week, we'll get tips from getting your newborn twins to sleep. This is Twin Talks, Parenting Times 2.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com.